Millions of people across Europe live with respiratory problems without really being aware of their condition. Allan Stone was one of them, suffering for years from an undiagnosed pulmonary illness. A former smoker, he developed one worrying symptom after another.
Well, just breathlessness. Breathlessness, being really out of breath and feeling lethargic and sleepy all the time.
It took a significant event in Allan's life to finally convince him to visit a pulmonary specialist for a spirometry test.
When I went for dinner with a friend of mine in Mayfair, and after that we parted, I had the dog with me and I walked to the bus stop, and it took me 3/4 of an hour to walk 250 yards.
Allan discovered through his medical tests that he is suffering from an illness called COPD.
COPD stands for chronic obstructive pulmonary disease. It's a disease characterized by chronic airflow obstruction that leads to a number of events that are systemic events, like inactivity, cardiovascular disease like diabetes and other things.
Usually caused by exposure to tobacco smoke and other air pollution, this illness is characterized by a progressive obstruction of the airways and lungs. COPD is a highly prevalent and underdiagnosed disease. The World Health Organization estimates that 210 million people are currently living with COPD and 44 million in Europe.
COPD is the 4th leading cause of death, and it's something that people are unaware that it's actually there and that it's killing them. So we need to make it known to the public. We need to make it known to the European people what COPD is, how to prevent it, or how to diagnose it early. I would like to thank everyone for coming to the European Call to Action on COPD.
On the 30th of June 2010, Allan told his personal account of his suffering to the European Parliament at a reception organized by EFA, the European Federation of Allergy and Airways Diseases Patients Associations.
I'm really heartened by the fact that people have taken so much trouble to come together to talk to each other and exchange ideas about the problems of COPD.
Thank you very much for inviting the Commission to take part in this important event. It is a call for action which addresses one of the most important public health concerns across the European Union.
The parliamentarians and the Commissioner can do a lot of things about this disease. First, they can make it known to the public, because COPD is not a common name. So the people that don't know what it is and who is responsible for that is first the medical societies plus the politicians. The second thing they can do is try to make tougher laws for this tobacco smoking in Europe.
EFA has published a book about the state of care of COPD in Europe. In it, patients' associations from 12 European countries responded to an extensive questionnaire on the subject.
One of the major findings to emerge from the book is that there is a great difference between the services given to patients in urban areas and in non-urban areas. So more should be done to standardize treatment throughout a given country.
The work required is substantial. In Europe, patients are often diagnosed too late or incorrectly, and not all hospitals have the correct screening equipment. Spirometry testing measures how well one breathes. It's a simple test that can be done in a physician's office.
One way to fight this disease is to get the early diagnosis, and that is through spirometry. So we need to help healthcare professionals to acquire the tools to be able to make the early diagnosis, because the earlier you detect COPD, the treatable it is, and it will not create such a heavy burden on that person's life.
The first type of actions would be actions to promote the use of treatments that we currently have, but that are currently underused. And a very good example of that is rehabilitation. We know that less than 5% of the patients who are eligible for a rehabilitation program actually get into a rehabilitation program. And the second thing is that we need to invest in research that will lead to better drugs that will fundamentally alter the course of this disease.
The work carried out in collaboration with a member of the European Parliament, Catherine Styler, forms part of the wider framework regarding the 2010 Year of the Lung initiative.
Thank you for being here, and I'll continue to fight for people with COPD.
The aim is to raise awareness of COPD as a serious public health threat among EU policymakers.
The fact that research, access to care, awareness raising, I think all of those put together mean that there are gaps out there, and across the European Union we see that one country, we need to learn from each country, we need to learn from best practice, we need to see where lung disease is best recognised and best treated, and we need to ask the patients themselves, because if we don't talk to patients directly then and hear their voice, that's why it's so significant that patients were here today to take part in an event where their voices are truly heard and recognised.
Well, it has to be a unity of forces. So that means that a lot of people who have something to say on the matter should get together to make some action plans, and that is the patients, the healthcare professionals, policymakers, anybody who could actually have something important to say to an action plan that can then implement it into the European people.
We don't have to be resigned to COPD. It can be treated and patients can regain a good quality of life. Allan Stone is living proof of this since beginning a treatment plan that includes practicing a few respiratory exercises daily allows him to live almost as normal a life as any other person. The call to action on COPD is clear. We must make COPD a political priority, increase awareness of COPD, prioritize early diagnosis, improve air quality, support research on COPD, and improve its care and management in order to offer the patients a variety of solutions.